Good morning, everybody, and welcome to our SP1159 webinar, back by popular demand. So we originally had our event to talk about the executive order as relates to workers' comp. We were all standing by, seeing what was going to happen after July, and popped up SB 1159. So many of you asked if we could have Peter back again, and I begged and pleaded with him, and he said yes. So Peter, want to welcome you back again. Thank you again for taking this opportunity to speak with our audience again about this new development. Really the goal, everyone here, is to kind of give you a primer of what it is. Peter mentioned before to me, it's like a 3-in-1 law. And so we need to really kind of go over the specifics. At the very end, we will have a Q&A, and then I will be showing you just some of the forms that we're dealing with as it relates with the carriers and our clients, and some guidance in regards to filling out those forms, either retro claims or also future claims, and some of those time frames as well too. So Peter, wanted to welcome you again. I know we have a lot of information to go over. Also, all of you that are on the presentation today, we have attached the handouts. So if you wanted to open up those, print them out, and you could jot down some notes. And also keep in mind this is recorded, so if you need a refresher of this course, just let me know and we'll send you over the recording. So Peter, welcome again, and tell us what you're going to be going over.
All right, first of all, thanks, Tony. Thanks for having me once again. I'm pleased to be here, and I want to thank the guests, the participants, for being here and spending an hour with us. I'm here to talk about SB 1159, the new law that was passed by Governor Newsom on September 17th, assessing and addressing the issue of coronavirus. Essentially, this is the state of California's response to the ongoing pandemic. His earlier executive order was an early response. Now we have 3 laws that are now labor codes that we have to deal with, at least until January 1st, 2023. As you can see in the slide, this law applies to all cases of coronavirus from May 6th until January 1st, 23. It's a long time. So that's an acknowledgement that coronavirus might be here for a long time. And this law provides injured workers presumptions that under certain circumstances, that if you contract coronavirus, that it's presumed compensable. Now, those of you who have been in this business for a long time, and I've been in this business for almost 30 years, we've seen all the ups and downs in workers' comp, and the word presumption in general is a bad word. There was the presumption of compensability in the early 90s. That was a big problem for our system. There was the presumption of correctness that was given doctors. That was a huge problem that led to a lot of fraud in our system. And likewise, I think this presumption can be problematic. So the goal in this talk is to let you know what the presumptions are, but more importantly, how to avoid the presumption if you can, and if the presumption applies, what to do to try to rebut it, because it is a rebuttable presumption, not a conclusive presumption, which is a big difference. Next slide. All right, let's talk about the purpose of SB 1159. Again, it's the acknowledgement by the state of California that coronavirus is here. So far, 42,000 claims have been filed. 11% of all claims are coronavirus in California. Of those that are filed, I guess I understand 30% is from healthcare workers, 16% are from fire and police. I think in August there was 8,000 deaths up to that point in time. So it is a serious issue, and it is an issue that we think in California might start climbing. And the desire of 1159, the intent of 1159 was two things. They wanted to make sure that employers are doing everything they can to take coronavirus seriously. This law is designed to make sure that employers provide as safe a workplace as possible. And if they do, then they can avoid these presumptions. And the idea is to keep injured workers as safe as possible. But if they contract coronavirus, they want injured workers who have contracted coronavirus to have the necessary support, meaning medical care, disability benefits, so that if they contract it, they get what they need to get back. And that was the intent. And what the attorneys' responses have been, defense attorneys are very wary of this issue because, again, presumptions are not generally a good thing in workers' comp. The applicant's attorneys are looking at this as a leg up, basically an advantage, something that they can take and run with to get their claims easily found compensable. And that's the early response. Next slide. So SB 1159 creates this rebuttable presumption for all California employees under certain circumstances that if they contract coronavirus, that it happened at work. All right. So from an employer standpoint, if you have an injured worker or one of your employees that has coronavirus, I mean, you can get coronavirus from anywhere. And to say it's presumed to have happened at work is difficult for all employers to accept. Because once you are given this presumption, that injured worker is entitled to all medical treatment, temporary and permanent disability, and death benefits that come with workers' comp. And it comes with all COVID-19 related illnesses. So what I'm worried about is not that injured workers who are working during the pandemic who contract coronavirus don't deserve some medical care or some time off and some disability. What my biggest concern is that once you get that presumption, there is a portion of California workers' comp that take advantage of these presumptions and run with it. So when it says all COVID-19 related illnesses, I can easily see, and it's already happened from the cases that we have, that it's not just the coronavirus that they're going to allege. They're going to allege things like a psychiatric add-on. I'm depressed because I have coronavirus, I can't work, which is something that, is reasonable. But where you see things on top of that might be claims of internal illness because of my stomach problems from the medications, or I'm having headaches, I need a neurologist on quarantine, and I stayed in bed for 2 weeks and now my back hurts. And then there's all other areas of additional injury that it's hard to say whether or not they're related to coronavirus, because coronavirus has only been with us for 9 months. And for a doctor to say you now have lung problems or heart problems that was due to coronavirus, that's going to be very difficult to litigate, because what doctor do you know of can say that they're an expert on the issue and can say with reasonable medical probability that this was due to coronavirus? So once that presumption applies, you're in damage control now, and damage control in California can create a lot of litigation, and that's my concern. Next slide. So let's talk about the law. The law was broken up into 3 different labor codes. The first one is 3212.86, which is essentially a codification of the previous executive order. So the previous executive order applied for injuries that occurred on March 19th, 2020 to July 5th, 2020. And when they say the injury occurred on, that means the date of injury was the last date you worked at prior to your positive test. So if your last day worked prior to a positive test was during this period of time, this is the law that would apply. And this applies to any injured worker who tested positive for coronavirus by a positive test or was diagnosed as having coronavirus by a surgeon or licensed physician. And now they allow for physicians, assistants, and nurse practitioners to diagnose the coronavirus as well, as long as they're under the supervision of a surgeon or a licensed physician. So that's step one. Step two is you take that diagnosis or test and you trace back 14 days from then. And if that person worked at the workplace, meaning not home, that's the second criteria. And then thirdly, 30 days later, you must have another positive test. And if you have that, your coronavirus is going to be presumed to have happened at work. Next slide. If that presumption applies, you have 30 days to rebut that presumption. That's your open window to rebut the presumption. 30 days, as we all know, comes and goes really quickly. And in my last talk, I talked about having immediate action implemented once that claim is filed. Once you get a claim form filed by an injured worker saying they got coronavirus from work, you have 30 days to rebut it. 30 days to find out whether or not there's any evidence that you could find that this person actually got coronavirus elsewhere. That's the idea. Take those 14 days prior, find out everything you can about what that injured worker did, and see if there's any evidence that you can find that that coronavirus came elsewhere. So what do you need to do? Well, we talked about taking depositions, doing investigations with the employer, doing some social media checks. All those come into play, and you only have 30 days to do it. So that's the idea of handling those type of claims. Again, that's for claims that went through July 6th. And that was my initial proposal on those issues. Next slide. The second law, 3212.87, is new, and it's a presumption that applies to frontline workers only. So if you have an injured worker that is a frontline worker for a date of injury after July 6, 2020 to 1/1/23, this is the presumption law that applies to those employees. All right, so what is a frontline worker? So the Labor Code does a pretty good job of explaining who is a frontline worker, but essentially they're peace officers. That might include volunteers, firefighters, healthcare workers, home health agencies, fire and rescue service, health facility workers, registered nurses or EMTs, and providers of in-home supportive services. If you're that employee, if you're a frontline worker and you contract coronavirus during that time period, this is the presumption that applies to those workers only. This includes custodians, housekeepers, if they've worked at a healthcare facility and were in contact with coronavirus patients. Next slide. So if you're that type of worker, you get a presumption that your contraction of coronavirus is industrial if you take you have a positive test, which they limit to the PCR testing for now, which is the swab in your nose, and 14 days prior to that positive test, you actually worked at the workplace under the employer's direction. And so basically, if you worked from home, that doesn't apply. All right, and the last day of work that you worked at the workplace has to be on or after July 6, 2020, as the date of injury is that date, okay? So that's all you need to get the presumption. Firefighters are given that presumption. All you gotta do is show that you worked at the workplace 14 days prior to the testing of the positive testing. So now you have a presumption. And if you have that presumption, injured workers are going to look to the employer and say, you now have 30 days to rebut it. And the burden of proof is on the employer. So within 30 days after the date the claim form is filed, you got 30 days to show evidence that that injured worker more than likely contracted coronavirus elsewhere. And that's a high, that's a quick task. So what kind of evidence do you have to show? Employer level of prevention is one thing to show. If you could show that your workplace has had a program put in place to provide effective training for your employees on coronavirus, how to avoid it, how to not contract it, and if you do contract it, what to do. If you have a plan in place at your place of employment that vigilantly requires the use of masks, disinfectants, has cleaning protocols, practices and enforces social distancing, hand sanitizers, that's also a factor. That you have effective control of customer and public interaction. If you only allow a certain amount of people in, you make them practice social distancing, that they wear masks, that you train your employees what to do with someone that comes in without a mask. These are all factors that come into effect as to whether or not you can rebut that presumption. Again, this is part of the plan of California to provide employers the impetus to properly put in place preventive measures to not so that the spread of coronavirus doesn't occur. Investigations that you can do as well. Social media checks. I'm getting a lot of calls from investigators saying this is what we can do under these laws. And what they'll do is they'll look at Facebook and all those other social media apps that they can get a hold of and that they get access to and find out where they've been the 14 days prior. So for example, if that injured worker went to a family gathering where there was an outbreak, or they went to a restaurant where there was an outbreak, or they went to a church that there was some exposure. These are all factors to show that an injured worker's coronavirus was caught somewhere else. Investigation with coworkers. You want to find out from a claim standpoint, did this employer have safety protocol and was it followed? Again, these are factors that you can show a judge down the road that, hey, this person caught coronavirus, but this employer did everything they could to make sure it didn't happen. This employer had no other coronavirus findings. And our social media check and our investigation showed that this person's family member has it, someone's mother has it, someone he lives with has it, or they went someplace where there was an outbreak. That might be enough to rebut the presumption, and that's what you want. You want to make sure that if you can rebut the presumption that you do it, and you do it within those 30 days, or else you got a presumed compensable claim that you're paying benefits on, and that could be, hopefully a small claim, but it could be, a death claim, it could be a hospitalization claim, who knows. You want to find out from your coworkers if they know of anything about that injured worker's home. They may have heard from that injured worker that, hey, my mom just got coronavirus, or my wife just got it, or my sister, whatever. That information can be used to help you rebut this presumption. We also want to find out if the injured worker has any pre-existing health conditions. For two reasons. You want to find out pre-existing health conditions can lead to anticipation of an outcome of the coronavirus that might be worse than usual. And you want to find out that information because we'll talk about this later, but apportionment still applies to these type of claims. Next slide. Deposition. This may sound self-serving, but I think that if you get a coronavirus case, you should schedule the applicant for a deposition as soon as possible. Again, 30 days. And if you have 30 days, setting a deposition takes time. So you want to get your defense attorney on the case as quickly as possible, set that deposition, and under oath, question the applicant about where they've been those 14 days. You can only find out so much from social media and so much from coworkers, but if you have the actual injured worker before you and you say to them, okay, you contracted coronavirus or you were diagnosed with this coronavirus on this day, what were you doing prior to that? Who do you live with? Does anybody in your house have coronavirus? Does anybody in your family have it? Get that information as quickly as you can, and then follow up. Have your investigator contact whatever restaurants they went to and see if they had any viruses, or whatever church or whatever beach, wherever that person went. Get that information as quickly as possible. And then the next thing you want to question the injured worker is about safety measures in the workplace. Were you aware of social distancing? Did you practice wearing a face mask? Did you practice wearing gloves? Did you practice hand sanitizers? And hopefully they say yes, and that makes it less likely that they caught it at work. These questions can be asked under oath, but again, with a 30-day period of time to deny a claim, you want to get that information as quickly as possible. And if the injured worker doesn't show for his depo, then you can argue that your denial after 30 days was due to the fact that you couldn't get that information before. So again, the idea is try to get the presumption not applicable to your case, but for first responders, that's going to be difficult. So in those cases, the best thing to do with frontline workers is to rebut the presumption as best you can. All right, Labor Code Section 3212.88 is the third portion of this law, and this applies to all other employees, anybody but frontline workers under the definition. So for those of us in the audience, that's going to apply to most of you. The grocery workers, the gas station workers, everybody else that has been working since July 6th to now, that's not a frontline worker. And as time goes by, more and more employees are going to get back to work at the workplace. So this is the law that applies to those people, those workers. So this is the presumption that I think we most have to concentrate upon. Again, the basic presumption requirements are that you have a positive test by the swab test. And then you trace back 14 days from that positive test. And if that person worked at the workplace at the employer's direction, that's the second requirement. Now, the workplace cannot be that person's home. So if people working at home, this does not apply to you. But if you, in those 14 days, want to work even one of those days, this presumption, you fulfill that second requirement. Next slide. All right. The third test, the third requirement is that that workplace has to be considered an outbreak. If that specific place of work is considered an outbreak, that is the third requirement. And that's the requirement that's going to be most problematic. And that is the requirement that the employers have to be vigilant about, the claims offices, adjusters have to be vigilant about. And this is the area where we can best avoid this presumption. So what's an outbreak? What constitutes an outbreak? All right. Next slide. All right. So you have an injured worker comes to you and says, I have coronavirus and I think it happened at work. You give him a claim form, he files it. And at that point, you need to find out, did they have a positive test? When did they have that positive test? And trace back 14 days from there to see if that worker worked at a workplace. And then what you want to find out is if during that period of time, that place of employment, that workplace is considered an outbreak. And what's an outbreak? If you have a place of employment that has 100 or fewer employees, that means that 4 people have tested positive. All right, if you have 4 people have tested positive in your workplace and you have 100 or fewer employees, that's considered an outbreak. And you've now fulfilled the third requirement to be considered under this presumption. If you have more than 100 employees, then it's 4%. 4% of your employees have tested positive. Or your place of employment where that person worked at was closed down to a risk infection, which obviously means that you've had an outbreak. So that's what's considered an outbreak. So again, that's the third requirement that puts you in the position of dealing with a presumption. So that's the third requirement that you need to do your best to avoid. All right, and you can avoid it, the presumption doesn't apply. And if you can avoid it, you don't have to worry about what comes after that. It's otherwise a regular workers' compensation claim. You have 90 days to accept or deny, and you don't have any presumption that it is industrial. Big difference. And that's why it's important to be outside of the definition of an outbreak. From an employer's standpoint, and I'm an employer, what you need to do to prevent your workplace to be considered an outbreak is, again, do the best you can to prevent coronavirus spreading at your workplace. What does that mean? Well, again, face masks, hand sanitizers, social distancing, education, customer control, things of that nature. And if you can do that, you don't have to worry about this law. This law doesn't apply to your workplace as long as you can keep outside of the definition of an outbreak. And I can tell you right now, as an attorney and dealing with workers' comp as long as I have, that applicants' attorneys are going to fight this tooth and nail. They're going to subpoena your employment records, your information that you sent to the claims, and they're going to scrutinize it to see whether or not that 4% or those 4 more employees has been reached. And so you as employers, you as claims examiners and claims people have to keep good records, because those records are going to decide whether you're in an outbreak or not. So what happens if you're in that presumption? If you do have an injured worker that has COVID, was at the workplace within 14 days, and your employer is considered an outbreak, then you have a rebuttable presumption. And that presumption in these situations, you have 45 days to deny. 45 days is a little bit more, but not much more. Still, 45 days comes and goes very, very quickly. And that requires a strong response by claims to do everything they can to rebut this presumption. And in the labor code itself, 3212.88E2, they talk about what you need to do to rebut this presumption. And they talk about evidence of measures put in place to reduce the potential transmission of coronavirus in the employee's workplace. So again, prevention. Second thing is evidence of an employer's non-occupational risks of COVID-19 infection. So again, that's your investigation outside. The social media, the employer level investigation, the deposition of the applicant. And if you can find somehow that between work not having a lot of cases and prevention protocols put in place, and that the injured worker went someplace else during that time period that was a risk, then I think you might have a basis for denial. But again, you have 45 days to come up with that. That comes and goes very quickly. So from a claim standpoint, I think you need to act on these cases just as quickly. And that includes a deposition. And once you have rebutted the presumption, then it's up to a judge to decide whether or not that evidence of your presumption is sufficient to take the presumption out of the equation. Okay, so you have this issue of what is an outbreak. So if you're an injured worker and you get your claim and you file it, your attorney is going to ask, is your workplace an outbreak? And the only way they're going to find out if your workplace is an outbreak is based on information provided by the claims and the employer. So the law requires now that every employer outside of first responders to provide information. So this requires every employer to be proactive. The law states that when the employer knows or should have known that an employee has tested positive for coronavirus, the employer shall report to claims by fax or email within 3 business days. All right, so just think about that. Injured worker comes to you and says, I have coronavirus. You have 3 days to report to your claims people that an employee has tested positive. You don't provide that person's name, the date of the positive test. Next slide. Where that person worked in your workplace the 14 days prior. And the highest number of employees who reported to work in the 45 days prior. All right. So from an employer standpoint, again, this is a lot of information that you got to provide within 3 days. Guy comes to you, says, I have coronavirus, works at your workplace. You got to file this within 3 days. You got to tell claims all of this information, and you got to provide them with information as to how many employees worked at that particular workplace the 45 days prior. And that's the information that claims has to put in file on your account so that if a coronavirus case does come in, they can provide that information to the injured worker's attorney to say whether they are in an outbreak or they are not in an outbreak. So you're going to see letters from claims saying the presumption does not apply in this case because there was that this employer was not within the term an outbreak during that time period, and here's the evidence to support that finding. And that's the information that you, the employer, are going to provide the claims office to provide to the parties and the judge eventually. And false or misleading information subjects you to a $10,000 fine. So obviously you got to be truthful about it. I would highly recommend that every employer assign a dedicated person to be in charge of accounting and reporting all this information. They have to count the employees, report the information to claims, and keep doing that every time an injured worker comes in and says, I have coronavirus. And that's if an injured worker comes in and says, I have coronavirus, even if he doesn't file a claim. If he files a claim, you got to give him a claim form. If he says, I have coronavirus, I'm going to go home for 2 weeks to quarantine, doesn't file a claim, that's when that triggers your 3-day obligation to provide that information. Just so you know, on the horizon, AB 685 comes into effect in January of next year, and that's going to require employers to tell their employees within 48 hours of a potential risk. So if somebody comes in and says, I have coronavirus, and there's an exposure, you got 48 hours to tell your employees of that potential exposure. Kroger was recently fined over $100,000, not because of this law, but because they were fined by Cal OSHA for not doing effective training, for not having effective safety measures. Specifically, no effective training on how to avoid infections and how to find signs and symptoms of the disease, how to safely use cleaners and disinfectants. They failed to report a COVID-related death within the time frame, allowing too many customers in and having no barriers installed at checkout counters. So again, coronavirus and California, the legislative goal is to make sure that employers take it seriously and place into protocol preventive measures. If your employee comes to you and tested positive before the implementation of this law, September 17th, 2020, and says, I have had coronavirus, and that testing was done during that time period, the employer then shall report to claims via fax or email within 30 days the information and how many employees were at that workplace from the entire period of July 6th through September 17th. So in the case where you have an employee contracting coronavirus before the effective date, there's that retroactive requirement. All right, so what happens if the presumption applies? Again, this is the part where you don't want to hear. You want to avoid the presumption as much as possible. So as an employer, the best way to avoid the presumption is to not be in an outbreak. If you're not in an outbreak, all the stuff I'm going to talk about now doesn't apply. The presumption, if it does apply, then the injured worker is entitled to all benefits under workers' comp. Presumption that the injury, the contraction of coronavirus happened at work, and therefore you're entitled to everything thereafter. All right, that includes temporary disability, and that requires benefits to be provided after all paid sick leave is exhausted. There's some other limitations, but you're generally entitled to temporary disability. All treatment related to coronavirus illness. All right, again, I talked about in California, I anticipate, and I have seen it already, applicants' attorneys are going to file more than just coronavirus. They're going to say more than just respiratory illness. They're going to start asserting, and you've probably all heard about the add-ons, and they're going to be add-ons. And these add-ons are going to add up to more and more money being spent. The qualified treaters, who's going to be out there? They're going to say that I can treat coronavirus. How many workers' comp attorneys, doctors are there that are going to be out there that can say, I can effectively treat? There's a very small pool of workers' comp doctors already. And from that pool, a lot of them still don't know what TTD is. So the amount of doctors that are going to be involved in these type of claims, you're going to have to question their qualifications, especially if they're going to make diagnoses that relate to other areas. You're going to have to ask them, how do you know? What qualifies you to say that? Permanent disability. Again, you're entitled to all workers' compensation benefits, including permanent disability, not only from COVID, but from all COVID-related illnesses. Apportionment laws still apply. So a lot of the cases that result in long-term care, long-term disability from COVID are due to having pre-existing conditions, unfortunately. But those pre-existing conditions have to be explored solely on the issue of apportionment. And, you know, there are 210,000 deaths in the United States. Death benefits are also provided to workers under this presumption, unless you have no dependents. Next slide. All right, so those are the laws. I know I went through really quickly. Well, those are the laws as I've interpreted them. Again, this is an early interpretation of the law. In California, laws change, our interpretation of laws change. And I've seen through my 30 years that what was this could turn into something else 10 years later. So who knows? But this is my interpretation, and here are my practice pointers. Again, prevention. Prevention is the key to avoiding these presumptions. An employer that has strong preventive measures put in place before the contraction of coronavirus is that the employer that's going to look good to a judge. Put into place as many protective measures as you can. Document them so that you have memos to all employees. Do all these things to make sure it doesn't happen. training, education, enforcement, control public interaction. I've seen a lot of stores where they have someone at the front door limiting who comes in and who comes out. Restaurants the same way. That's a strong piece of evidence to show that you're doing what you can to prevent the spread. Again, there's AB 685 that comes into effect that requires employers to tell employees of an exposure. Next slide. All right, accounting. You need to have someone that's going to comply with the law. If you're not a frontline worker, all other employers have to have put in place a reporting practice to comply with the law. Tony's going to show you some forms that some of the insurance companies have already come up with. And I've reviewed some of them, and they're strong. You can use those forms so that if you get a COVID employee, you fill out the forms and you fax it or email it to your claims within 3 days to comply with the law. Because my anticipation is that there's going to be a lot of litigation of what constitutes an outbreak, and that litigation is going to lead to a lot of requests for records. And if you don't have proper records or good records or reliable records, a judge is going to look at that and say, I'm going to say the presumption applies. You are in an outbreak because you couldn't prove to me that you're not. Now, that's just my opinion, but the best way to avoid that is to have good records. So provide claims with good records and provide timely responses. If the presumption doesn't apply, that's still not going to stop people from filing claims. But if the presumption doesn't apply, you have those 90 days to accept, and there is no presumption. You're on an even footing at the time that the claim is filed. All you have to show is that that injured worker more than likely got the coronavirus elsewhere. If the presumption applies, you have, depending on which law applies, 30 to 45 days to respond. Do your due diligence to fully investigate the claims, to rebut the presumption timely so that you don't have that presumption in place. Next slide. So far, most claims have been minor in nature, but it's those 10, 20% of claims where there's long-term health care, hospitalization, and death. Those small amount of claims, those are the ones you need to avoid. So that's why you got to take every claim seriously, because you only have 30 to 45 days to effectively deny that claim, and you don't know by that point how bad it's going to be. If the claim is not timely denied, the law clearly states that the judges are bound to find injury and award compensation under this rebuttable presumption law. Okay, I think I went past my time, so I'll end there and let Tony take over.
You're probably more important than me. Just some that we have from the audience here. One, Rosie says, hello, Peter, nice to see you. So just want to start with that. The first question, well, I have 3 here, and then we have some others that are popping up as well. So the first one is the presumption still based on the employee stating they got COVID at work? In other words, if an employee states he or she did not get it at work, we cannot assume this to be work related, correct?
Okay, so if an injured worker comes to you and says they have coronavirus, my general rule is to ask, unless you know they've been working from home, whether they think it was work related. And if they say I think it might be, then you give them a claim form. So that's my general rule. It's better to know than not know is my position. But if an injured worker just says I have coronavirus, I'm sorry, an employee comes to you and says I have coronavirus, you know, it could have happened at work, it may not have happened at work, but you do the reporting. The reporting requirement, I think, is such a strong piece of evidence to show whether you are in an outbreak or not in an outbreak, that you still report it to your claims offices. Now, if he says nothing more than that, says I have coronavirus, and I'm going to take the next 2 weeks off to, quarantine myself, and he takes a leave of absence, that's where you need to report the claims. But there's nothing more that you need to do at that point.
Got it. Perfect. We have another question, and how does this coordinate with the CARES Act? If there's an outbreak in the CARES Act with payment for 80 hours applies, which comes first?
All right. Well, the period of temporary disability in workers' comp doesn't apply until all sick leave is exhausted. So if you have Federal CARES Act, if you have sick leave mandated by whatever law based on COVID, meaning that you have sick leave that was given to you due to the fact that you have COVID, that has to be exhausted before workers' comp pays anything. So some people may have more than 80 hours. Some people may have none. So depending on what you're entitled to, that is what has to pay first. The employer has to provide you with that paid sick leave first before workers' comp TD kicks in.
Got it. Thank you. We have here, how do you do headcount when your employees work on multiple trade job sites?
Okay, that's a very good question because I don't know. The bottom line is that that's a gray area in this law that I think it's going to create a lot of litigation. There's 1,000 different types of employment, and during those different types of employment, people may work at a workplace one day, a workplace another day, or various places in the same day. So does that count? Now, the conservative response would be yes, but let me read to you the actual law. It says a specific place of employment means the building, store, facility, or agricultural field where an employee performs work at the employer's direction. All right, and that does not include home. All right, so anything outside of home could be considered a specific place of employment. So for purposes of what you report to claims, so for example, if someone comes to you and says, I got coronavirus, and you need to report it to claims, and part of that requirement is to tell claims what's the most amount of employees that showed up at that workplace the 45 days prior. How do you count that? All right, so if someone came in for an hour, does that count? Does that, again, multiple places of employment, does that count? And there's all sorts of different businesses where the place of employment is going to be very gray area.
Right.
So my answer, again, is I don't know. My answer is that this is going to be subject to litigation. And I just read to you the actual definition in the law. So you can see there's a lot of gray area. And I do expect there to be a lot of litigation. Most places, the place of employment is not that gray. They come to work, it's a workplace, that's what it is. But there's a lot of workplaces where it's going to be a gray area. So, we'll see.
And Diana, I'll actually show you one of the forms. It's pretty extensive. You can put, some of the forms actually have 10 spots in regards to locations. Other are a full spreadsheet as well. So you'd have to put down all the locations that this person was at in 14 days. We have a questionnaire. We are testing all of our employees, production related. We test before employment and after they begin work. If after they begin work and they test positive and are asymptomatic, we still need to report these, let's say we need to report these, sorry, this is a long one, for after, still need to report these and obtain the 3 requirements for each one of these cases.
Yes, I mean, like I said, anytime an injured worker comes and says they have coronavirus, the requirement is put in place. So even if they tested it negative for 2 weeks prior to that, once that positive test comes in and you're made aware of it, or you should have been made aware of it, that's when the requirement kicks in. And
Got it.
again, 3 days comes and goes very quickly. So you have to do not only find out when that test occurred, but you have to do the accounting of the 45 days prior, and then you have to email or fax it to claims within 3 days. That comes and goes very quickly. So again, a lot of employer obligations under these new laws.
Okay. We have a record keeping question. When you say good record keeping, is there a form you recommend that we use, or what specific info should we use to ask and keep?
Okay, well, the best record keeping requirement that the most difficult record keeping requirement is the 45 days. So you're going to have to look at where that person worked 14 days prior, and each of those workplaces, you have to know how many employees worked at that workplace the 45 days prior, and then find out what's the highest number. So what I say about good record keeping, you're going to have to come up within 3 days with that information. So the more you keep records of each day, each workplace, how many people were there each day, the easier that job becomes. Again, that sounds like a lot though. So depending on who you are, I mean, if you have 45 different workplaces, that's going to be a very difficult record keeping requirement. But if you only have 3 offices, that shouldn't be that hard to do. And you need to keep those records on a daily basis so that when and if you do get a claim, your response to it shouldn't be that difficult. You just take that highest number within those 45 days, and that's the number you give to claims as the highest number of employees that worked at that workplace.
Perfect.
It's all new, and as Tony indicated, there are forms that insurance companies are preparing for you to use to comply with the law, and you might want to use those forms as well.
So I'm going to go into, I know we have a couple more questions here, but I might send those over to you. Peter, what I wanted to do was quickly is we've gathered the forms from the major carriers, Berkshire, ICW, Republic, Pacific Comp, Everest, you name it, we have it. And we've been having one-on-one meetings with them and gathering information. I think the key part of this is you need to have a COVID defense kit, right, Peter? You need to have a COVID detective as well too. One of the things I didn't put on as a handout is I actually have a workers' comp COVID kind of a checklist, because like you were saying, Peter, you've got to get a lot of information while still trying to be compassionate and empathetic as well too. You will need to have some of this information. And what I'm seeing is a lot of people are saying, well, people that I live with, right, have coronavirus. Therefore, I've got coronavirus. And I'm always like, do you have that documented? Who talked to that person? Because we will probably need that down the road. Key thing is training, protocol, whether you be renewing your workers' comp, carriers are looking at you, Kalos is coming in, or you have an outbreak, right? You need all of this information. You really need to show, here is what we're doing, here is our protocol. This might be an eye exam for you all. These are just some of our major carriers we work with. What we're seeing is that there's going to be 2 different forms, okay? 2 different forms, and one being it's going to be, this is claims that are retro, right? July 6th to September 17th. Those have a deadline. What I'm seeing is the end of the month. They need to be in by the end of the month, okay? Again, a lot of times people are going, well, I don't want to turn this in. They're saying it's not work related. I go, it doesn't matter. If they told you they have COVID, you need to turn this in. What they're going to do is see how many of these come in and determine if, in fact, it's an outbreak. So what Peter said is this: we want to stay away from the word outbreak. One, the optics are horrible, right, Peter? Who wants to have, there's an outbreak, right? And you need to, Gloria, you mentioned too, location. I would definitely want to have the bigger location, right? So again, in looking at that, if you have less than 100 for employees, more than 100, that's 4% as well too. A lot of these forms have a backup, and you have to put the total number of people that were there. The carriers are going to be collecting this, and they're going to identify if, in fact, you do have an outbreak. If it's deemed that there's an outbreak, then you are going to be giving them the DW1C form. Okay, so talk to your specific carrier. Also, too, I'm asking all of the carriers and their risk managers, can you please do a walkthrough? Can you please go through with my client to make sure that they're doing everything possible? One, I want you all to get an A+. Two, I want it on record of everything you're doing, because one, if God forbid we have an outbreak, we're going through renewal, or you know what, we're talking to the adjusters now, I want them on record as far as saying they have been proactive, and I've seen it firsthand. Also too, if they have recommendations for you, let's ask for it as well too. But the biggest thing here is they're all kind of the same. They don't want you to put down the name of the employee, maybe an identifier, you know, employee number 102, the date of the test, the positive test. They also want to know how many people were there too. Peter went over the definition there. I would highly recommend that you sit down with your carrier, go through all these various forms. They're all quite different as well too. Here's another one with one of our carriers as well. And all of the carriers that we deal with, what I'm seeing is they have a special COVID email address as well too. So they're collecting all this information, and they're going to determine whether or not there's going to be an outbreak. Okay, so you know, one of the things you mentioned too is that 3 days, Peter. So you need to inform your managers to let you know, whether you're the person that actually deals with the workers' comp, talks to the adjuster, that they have 3 days. So they need to tell you as soon as possible as well too. I was on a carrier webinar, and the biggest thing that they talked about too is employer has direct knowledge and reasonably knows. Now, if I'm your employee and I've talked to your manager, but that manager has not talked to HR, then we have a problem, because I'm the employer, that manager, supervisor, and lead as well too. So all the different carriers, I'd recommend that you make sure you talk to them, get the specific forms, understand how to fill out the forms, understand where you have to send these forms as well too, because there's different channels. Obviously, prevention, right, Peter? That
Exactly.
is the key. That is my middle name is Tony Prevention Shibiyama, because it helps in the end. I don't want people on disability. I don't want to give bad renewals. I don't want Cal OSHA to come visit my clients as well too, because their mod is too high. So we do really, if you guys have any questions in regards to these, please let us know. But definitely go and get your specific forms from your specific carrier and get their feedback in regards to how to fill these out as well too. Some last housekeeping before we let you go. I actually have Cal OSHA speaking. I have a friend that works at Cal OSHA. I will not be meeting. I want to come in of your practices. Kind of ties in, right, Peter, with what we're talking about. I want to get it from the horse's mouth. I want to find out what's happening out there. What can employers do? What are they looking for? What are they finding people for? So, you know, same time, same place. We're going to have it October 22nd from 10 to 11. Just more of just best practices. And again, we're having Cal OSHA come in to speak. But if you guys need any assistance with any of your insurance, any of your risk management, please let us know. And Peter, I wanted to thank you so much for being our guest presenter. This keeps moving and changing. It's so complicated. And thank you so much for your expert advice. For those of you that deal with workers' comp and you have litigated claims, Peter and his group are fantastic. They're fighters. They really do educate. And at the end of the day, they do represent the employer groups as well to the best of their ability. And Peter, thank you so much. I appreciate it. If any of you have questions, please let us know. You have our email. We will send you some information at the end as well too, but wanted to thank you all for attending. Peter, again, thank you so much for your wisdom, your insight, scaring us as well too, and what's happening here. But the key word here, everyone, is prevention, prevention, prevention. Peter and I just want to educate everybody on the new developments, and please reach out to us. We will send you a follow-up email with our information. If you have some follow-up email or calls or questions, please let us know. But again, thank you so much for attending. We look forward to seeing you when we have OSHA and giving you some guidance there on safety as well too. So thank you all again, and we will see you all at the end of October on October 22nd. Have a good one. Bye-bye.
Thank you.